Vertigo is a sensation of motion that's abnormal. You're moving, the room's moving, something's moving. So in order to diagnose vertigo, we have a 4-phase method. First is history. We have an extensive history form that patients fill out to cover all the questions that we need to ask. Then there's an examination both by me and by an audiologist. Then third is a hearing test, because the hearing nerve and the balance nerve run side by side. And many times when there's an abnormality in the balance system, there's an abnormality in the hearing system. And then finally, but most important, is a balance test called visual nystagmography. This is a computerized test. We use goggles that have infrared cameras that can track and measure eye motion really accurately. That's the windows to the balance system. There's a woman who came in who was working in a factory or a business here, and her job entailed moving things from shelves and entailed looking up and picking things off the shelf. Of course, that was dangerous for her. Whenever she did that, she'd get dizzy and fall, and she didn't want things falling down on top of her. So we did our process, which history and physical, hearing tests and balance tests, discovered that she had a weakness in her inner ear, a significant weakness. Now, we can't fix that weakness, but what we can do is teach her how to overpower and to block that misinformation. So we started her on our vestibular rehabilitation program, which entails doing exercises 3 times a day, particularly eye exercises and some posture exercises. I had her come back within 2 weeks. We measured her performance, her dizzy performance, before we did this and after this, and found she had changed considerably, improved considerably, to the point that now she could look up and without falling over, tipping over, and she was back in work.